Hello, welcome to Focus. I'm your host, Mark Warnock, and today we're here with Ali Barraza, the Communications Director for the American Red Cross Connecticut region. Thank you so much for giving us some time to talk today.
Happy to be here, Mark. Thanks for having me.
Thank you. So tell me a little bit about, everyone knows what the Red Cross is, but tell me a little bit about what the Connecticut region Red Cross does.
Sure. Well, our main mission overall, Connecticut and beyond, is to alleviate human suffering. So we do that within the region, within our network across the country, by one, helping patients in need through our blood services program, our safety and training programs, our disaster relief operations. There are many different branches of the Red Cross just within Connecticut and beyond. And again, that's our main mission. We want to alleviate human suffering. We want to help people in their time of need.
That's great. So tell me a little bit about how you yourself got involved with the Red Cross.
You know, I have a TV news background, so I came to the Red Cross in our communications department. Prior to that, I was a producer and an anchor and reporter many years ago. But yeah, I came through our news track here. A lot of journalism folks kind of go into that public relations or communications realm, and that's how I got started here, which is just looking for an organization that I could really do some good work and get the word out, much like in my previous roles, but this specifically focused on one organization, really an organization that is doing good. And I've been thrilled. I've been here for almost 5 years now.
Wow, that's great. So tell me, or tell us a little bit about how you guys have adapted to keeping in touch with your clients and such during this whole situation that we all find ourselves in.
Yeah, well, I work in blood services, so we've really gone mobile even, prior to the pandemic. We are making it as easy as possible for our regular donors, our faithful, generous donors that come, certain times of the year, and then also new donors as well. We've really gone mobile, digital, whether through our website or our free to download blood donor app. So we make it, again, as simple as possible for people to log on, whether it be through the website, through the app, to be able to find appointments that are available in your area to donate, helping to keep our donor flow moving at the blood drives by enacting Rapid Pass, which is some pre-donation reading that you can do online on your phone or your laptop before you even get to a drive, just to make sure we're kind of cutting down like 15 minutes from your donation experience once you get there. So we're doing our part. We appreciate opportunities like this to kind of virtually, link up and help, people that are watching learn more about the Red Cross if they're not current donors. So we're all adapting, and certainly the Red Cross isn't alone there.
And how are things changed, like with actual donating? I know usually sit in lay on the table, get the whole thing done. How are you guys had to turn things around with all the social distancing and everything?
Sure. Well, we're doing our very best. We want to always ensure we're adhering to CDC guidelines for safety precautions. We take immense precaution anyways, but of course, on top of that, during this pandemic, we've really enhanced our safety protocols. So you still need to lie on the table, right, to get that donation drawn, the blood drawn. But what we're doing is making sure that every bed is 6 feet apart, spreading out because of social distancing. Even our waiting areas where you would typically have a line of chairs, set up for before you get called for your donation. The canteen area that we, serve refreshments at after your donation. All of these things are spread apart to ensure social distancing. Even before you get into the blood drive area, we do ask, that we take your temperature prior to entering to make sure that you are safe to enter. There is hand sanitizer that's available prior to entering, and then throughout the drive process. You're going to get a second temperature check during our health history session, confidential health history session that you'll work with one of our staff members on. And of course, we do mandate that face coverings and masks are required to enter the drive area. We're also, in addition to our safety protocols that we already enact, we're doing a heightened deep cleaning and disinfecting of all donor touch surfaces as well.
That's great to know, because I know some people might be worried, and now you know that it's safe to go in there,
Yeah.
donate your blood, and not have to worry about anything. And
Yeah, and
Yeah.
really, what we'd like to let people know, and we have since the outset of the pandemic, is blood donation is an essential service. So, if people have a little apprehension about coming out, please know that even our Surgeon General, the U.S. Surgeon General, has deemed this an essential service. So much like
Mm.
grocery stores and pharmacies, blood donation opportunities are going to be here because it is essential. There's a shelf life for blood. The need is constant. That's not going to stop for a pandemic or, holiday breaks or winter weather. So we need to ensure that those donations continue to come in, donors continue to come out. And again, we're making this as safe as possible for people to feel comfortable when they do.
That's great. That's fantastic. So tell me a little about how has this situation affected your guys' like volunteer efforts, like people trying to volunteer with you guys? How has that changed during this whole situation?
Yeah, well, again, just like the blood collection, the need for volunteers doesn't stop either. Our mission and our services that we provide do not stop in the face of a pandemic. So our volunteers are critical to our success. They make up the majority of our organization. We couldn't do work without our volunteers. We couldn't operate without our volunteers. So, we have had to reimagine certain things as far as blood services goes. There's these new measures now, like ensuring that volunteers can assist with blood check-ins as they typically do, but perhaps taking those temperatures as well, making sure that all these additional safety measures our volunteers can help out with as well. So always, it doesn't change because of this situation. We do always need volunteers. So if you are interested, whether it be through blood services or through other parts of our organization, all you have to do is go to redcross.org and learn more about volunteerism there.
That's great. It's fantastic. So tell me, as we get to the end of the segment, we'd like to ask all our guests this one last question. What is the one thing that you're most thankful for during this whole situation?
Wow, that's a great question. Thankful for Zoom, right?
Yeah.
Be able to continue to get the word out about this. Um, for a I am thankful first and foremost for our donors or those who are considering donating. Thankful for all those who take the time out of their day. It's not easy right now. We're all juggling a million things at home, a lot of people with childcare and full-time jobs and used to homeschooling right now, but people are coming out to make an appointment to take time out of their busy days to come and give and helps us save lives. So I am first and foremost grateful for that. And I would say also just grateful for an organization, that is able to help save lives. And it's such a pleasure for me to be able to join folks like you to be able to talk about this and what the needs are for, and how many different uses that can be utilized for different patients in need through this blood donation process.
Well, thank you for everything that you do over there at the Red Cross, and you guys do great work. So thank you for that, and thank you for spending some time with us and talking about and letting people know about the Red Cross. And we'll be back with more next time here on Focus.